Welcome back. The public is urged to remain vigilant as Mpox cases continue to rise. On Thursday, the National Department of Health reported 2 more cases, bringing the total number of cases to 22 since the outbreak in May this year. I am joined now by Director of African Health Research Institute, that's Professor Thumbi Ndung'u. Prof, a pleasure to have you on the program this afternoon. Given the recent cases, what are the key challenges in containing the monkeypox outbreak in the country?
Oh, thank you very much, Ntlandla, for having me on the show. I think that the challenge that is there at the moment is that there may be cases that are spreading without being necessarily symptomatic. Most of the people that have come down with symptoms from Mpox are people that had some kind of immunodeficiency or appear to have had some kind of immunodeficiency, for example, uncontrolled HIV infection or a case of diabetes, so people who have weakened immune systems. So there is some suspicion, although it hasn't been proven yet, that there may be cases of Mpox that are spreading in the general public, but perhaps not showing symptoms because of the fact that some of the people that are getting infected might have very good immune systems. So the situation is a bit unclear at the moment, but that could be what is going on at the moment.
But how can communities better understand the symptoms of monkeypox to really facilitate early detection and treatment as well?
I think at the moment, all you can do really is to look out for signs, which is the rash, the typical rash, and the swollen lymph nodes. Those are the most common symptoms of Mpox infection. But as I mentioned, there may be atypical symptoms. Certainly fever, sore throat are also very commonly associated with Mpox, and fatigue, general fatigue. But as I mentioned, it is possible that there may be cases that are spreading without necessarily being symptomatic. So people need to be just vigilant, know what the risk groups are, and if you happen to be in that risk group, seek medical attention as soon as possible, including when you get some atypical symptoms. So, for example, pain in the area, rectum has been also associated with Mpox infection. So I think we just need to be aware of these atypical symptoms as well as the general symptoms of Mpox itself, which will be the rash and the lymphadenopathy, which is swollen lymph nodes, and they seek medical attention as soon as possible, and also isolate if they happen to have any of those symptoms.
So if I understand you correctly, you're saying that we should rely on science. But speak to us about the role that research plays in developing effective strategies for managing and also preventing infectious diseases just like Mpox.
Yeah, I think first of all, we need to understand how the virus is spreading. This is the branch of science that we call epidemiology. So I think there's a need for us to better understand what are the risk groups. And at this moment in time, it appears that the most vulnerable group are men who have sex with men. Most of the cases that have come down with Mpox are men who have sex with men. And most of the cases seem to be among people who are immunocompromised, as I mentioned, people with uncontrolled HIV infection, so people who are not on antiretroviral therapy or have just recently been diagnosed with HIV. That is not to say that the disease cannot spread among other people. So this is the need for us to continue to do research in order to understand better how the disease is spreading in the general population, because it seems to be spreading certainly locally. And we also need to understand what percentage of the population maybe is not coming down with the typical symptoms. So this is the need for us to do research by identifying these cases, their contact cases, and trying to identify contact cases so that we can also follow those people up and see whether they actually also develop symptoms. But I think we also need further research to understand the virus itself. How is it Is it evolving? Is it changing? We know, for example, that it's a different clade of the virus that has been responsible for the outbreak of Mpox in the world over the past 2 years. That is different from the one found in Central Africa. And also we need to obviously continue to see whether we can get vaccines available in order to protect those that are most vulnerable.
Yeah. So looking forward, what steps should health authorities then take to also prevent future outbreaks of monkeypox in South Africa?
It's a very difficult question, and I think a very difficult issue to address because I think what the health department can do is to procure vaccines, as I mentioned, for those groups that are most vulnerable, and make sure that those people are vaccinated. I think that will stem the spread of it. But again, one of the most effective ways is the epidemiological. So identifying cases, and as soon as that case is identified, making sure that that case is isolated so that the virus doesn't spread from one person to another, but also identifying contact cases, so contact tracing, in order so that those people that may have been exposed can also be isolated and monitored, so that there is not widespread dissemination of the virus within the general population.
Right.
I think those kind of common sense epidemiological approaches will help to stem the spread of the virus, because certainly it's not a virus that is very efficient in spreading, as far as we can tell so far.
And how does the current monkeypox outbreak then compare to other infectious disease challenges that South Africa has faced in recent years?
I think there are similarities here. We can go back to COVID. Obviously, the spread of Mpox is not as efficient, as I mentioned, as COVID was. So I think we can be reassured that we are not going to have a massive outbreak of Mpox. Another example would be HIV, again, sexually transmitted infection. So quite different in terms of its epidemiology, but there are similarities here in how we can deal with this. It really is to reduce stigma, make sure that those people that are identified with the infection are treated and reported to healthcare facilities as soon as possible, and do contact tracing so that we can prevent the spread of this disease. And I think that vaccinating people that are most vulnerable, if the outbreaks continue, as we have seen over the past few months, I think that will also be very important.
So we've already spoken about the specific groups or geographic factors contributing to the spread of Mpox in the country. But what are the, call it, challenges in really diagnosing Mpox, and how can diagnostic capabilities be improved in this regard?
Well, I think at the moment, first of all, we are depending very much on symptoms. So we are really depending on people presenting, most particularly with the rash that is typical of Mpox. But I think we need to enhance our capability for genetic testing so that we can actually identify the actual virus and sequence the virus and be able to understand its genetic code. So I think that can help maybe speed up the diagnosis. It might be also that we need other diagnostic tests that could, for example, what we call immunoassays that are done in blood and can be much faster than, for example, genetic sequencing. So I think we need to explore all these as diagnostic tools. But at the moment, we are very much dependent on people presenting with the symptoms of the typical rash. And as I mentioned, one of the challenges with that is that not everybody may actually present with that typical rash. And so there is a case where you can get spread of this virus without it being noticed in some groups, given particularly the people are immunocompetent and they're not having immunodeficiencies.
Professor Ndung'u, in your opinion, what are the most promising treatments or rather options for Mpox? And are there any experimental therapies being explored?
There is actually a therapy that is approved. Usually, the Mpox management is focused on treating the symptoms, which is the rash in particular, and reducing the pain, because the rash can be painful. So it's managing that rash and making sure that that rash is taken well care of, so that it doesn't get infected, and then you have more complications. There is a specific antiviral that is being used now for treatment of Mpox. I'm not quite sure that it is yet available in South Africa. I think it may be available for emergency use. But I think if we continue to see a spread of outbreaks, it might be necessary that to bring that particular antiviral and make it widely available so that people can be treated. But at the moment, it really focuses on managing the rash and making sure that there's no secondary infections that develop in people who are displaying the symptoms.
Right. Thank you so much, Professor Thumbi Ndung'u, for sharing your insights on the ongoing Mpox outbreak, also giving us some sense of the symptoms that are associated with this virus.